How's everybody? Good morning. Good morning. Man, we have a packed house. Thank you for coming. This is such an important topic. Please sit down, and Secretary Kelly, get us started.
Well, thank you, Governor, and good morning, everyone. I am Secretary Janet Kelly. It's so great to be with you this morning to talk about a most sacred topic during this most sacred holiday season. As I look out over this room filled with a diverse group of people, whether you are friends or stakeholders, advocates, activists, or people who simply want to see life made better for moms and children, thank you for being here. It strikes me that we have three things in common this morning. One, a dedication to this topic. Each of you, as I look across this room, deeply cares about the future of our Commonwealth, which means you care about the future of moms and kids. Many of you in this room are moms yourself and give that role model to our next generation. And then, of course, we're all here because of a mom. So it's my honor this morning to recognize some special guests. Of course, we have Senator Emily Jordan here with us, who we're going to hear from later this morning. Please hold your applause to the end, or we will be here till lunch, and we don't want that. Delegate Ann Farrell Tata is here. Hi. Delegate Carrie Coyner. Delegate Amanda Batten. Delegate Ellen Campbell. Delegate Hillary Pugh Kent. Delegate Kim Taylor. Secretary of the Commonwealth Kelly G. Secretary Amy Gadara, Education. Chief Martin Brown, thank you for being here. Dr. Karen Shelton, our Commissioner of Health, is here this morning. Arnie Owens with DHP is here this morning. Arnie, hi. Cheryl Roberts, who runs our Medicaid agency, is here. Stephanie Spencer with Urban Baby Beginnings, good morning. Dr. Bazil is here this morning, hi. Kenda Sutton-L with Birth and Color is here. Shannon Purcell with VNPC. You're going to hear a little bit more about these groups later, so stay tuned. And then, of course, we've got some wonderful members of our Board of Midwifery. And I love hearing the babies. We are glad that they are here. They are the reason that we're here. And if they make a little noise, we are more than happy to have them in the room. So. Lastly, you're going to hear from four incredible speakers, two women with personal stories as to why we're here this morning. And then, of course, we're going to hear from the Lieutenant Governor and our governor this morning. And I just have to say, I wish that each of you could have a window into the priority, into the care, into the commitment that this office has on this issue. It's hard to remember a time. I've been in and out of state government for about 25 years, but I think it is a testament to how much of a priority this is, both the size of the audience and the time that we've dedicated to this, and of course, the announcements that you're gonna hear today. So without further ado, I would like to welcome Jasmine to the stage, who is gonna share with us her personal experience and tell us why this issue is such an important one. Jasmine, come on up. Thank you.
Good morning. I just want to say thank you for even inviting me to be here to share my story. Sitting in the front is my daughter. So 2 weeks after having my third child, and it was actually her birthday, I took her to King's Dominion, and it was fun. After it was a lot just having a baby 2 weeks ago. So after we left King's Dominion, I felt like I had a tightness in my chest, and for me, it was just normal postpartum symptoms. So I just took some medicine and it went away. Woke up the next day, same thing, tightness in my chest, took more medicine and it went away. This happened for 3 days, whereas it came back, took medicine, and it went away. The third day, and she was driving with me, it never went away. So it was just more so like an irritating feeling. It wasn't nothing that was super alarming. It was more so like cramps. They're irritating, but they're not that bad. So I wasn't alarmed. I called my husband and I said, hey, babe, the pain is back, but it won't leave. He said, call your doctor. So I called my OBGYN. I love her to death. She treats me like I'm her kid. I called her and I'm like, Dr. Davis, can you prescribe me some muscle relaxers? I just pulled a muscle in my chest. I was doing too much this weekend. It was my daughter's birthday. And now my left arm is hurting. And she said, wait. That sounds more cardiac than a muscle pull. Can you come to the hospital? And I hung up the phone and said, she's being so dramatic. And so I laid down and took a nap. So 30 minutes later, my phone is ringing and I'm like, hello? And she's like, Jasmine, where are you? And I'm like, in the bed. She said, if you do not get up now, I'm going to send the ambulance to your house. I was like, oh my gosh. So I got up, I went to the doctor and they did an EKG, x-ray, CAT scan, and everything was normal. So the doctor said, something just don't feel right. We're going to draw blood. He said, we're trying to test you for this protein called troponin. And if it's in your blood, then you're having a heart attack. So I'm sitting in the waiting room eating breastfeeding cookies because I was breastfeeding. My son was 2 weeks at the time. And the doctor and like 4 nurses come from the back. And he's like, you want a wheelchair or you can walk? And I'm just like, yeah, I can walk. What's going on? And he's like, come with me. And they're moving all fast in there. And I'm just like, what is going on? And he's like, you're having a heart attack. And I'm like, when? He's like, now. And I'm just like, okay. He's like, your troponin level is 41,000. And I'm like, so what's normal? He's like 60. So he's like, you've been having a heart attack for a couple of days now. And mind you, as we're having this conversation, everybody is moving fast. And I'm just like, by this point, I'm literally being pushed around in a bed and they're like, okay, we're going to insert a balloon into your chest. It's going to function as if your heart was going to function to give your heart time to heal itself. And I'm like, okay, but I'm crying like, okay, can I call my husband? Can I tell him what's going on? And he said my favorite line, which is time is muscle. So every second of every minute that we talk, that we stay here, we're risking your life. And 41,000 for troponin, you're supposed to be dead. So I didn't get to talk to my husband. But once I got the balloon, I did feel better. So I was excited. Later on the afternoon, the pain came back times 10. So this started at midnight. So at 1 a.m., at 2 a.m., at 3 a.m., I'm getting different medications. And nothing worked. So about 4 a.m., they come back in and say, let's do another EKG. We get that one. And literally like 30 seconds from getting that EKG, I have 2 cardiologists and 6 nurses surrounding my bed. And at that point, I'm like, what's going on? And the cardiologist said, you're having another heart attack and you're having heart failure. We need to do a double bypass. And in this moment, I'm crying. And I'm like, can I call my husband? Can I call my kids? And again, the same response is time is muscle. So, sorry, y'all. I think the biggest thing for me is not knowing that something was that wrong and just playing back into those 3 days of knowing that what if I knew and was educated on the signs? Maybe I didn't at 31 have to have a double bypass. Maybe I could have just had medication. Maybe a pacemaker. But to go to a 9-hour surgery and not be able to call your husband or your kids or not even know that you're going to see him again, to have a 2-week-old baby that you don't even know if they're going to even get a chance to get to know their mom. So to come back and have that surgery and to wake up, I feel overly blessed. And thank you. Sorry, y'all. I be trying not to cry, but it's like every time I say this story, it's like living it all over again. And just being so young and going through that, like, I could not hold my baby for 4 months. I had to learn how to sit up again on my own. I couldn't. I felt like I was learning how to be a mom all over again. And cardiac rehab was such a blessing to me. And cardiac rehab was my education piece. So, cardiac rehab, after you go through having open heart surgery, you have to go to, I went to Henrico Doctors, and it's literally what it sounds like, cardiac rehab, physical therapy for the heart. I was the youngest person there. So to go in there and give other people purpose and make them excited and learn from them. The biggest takeaway from just my story is education. Like, what I know now, if I knew then, I really felt like my outcome would have been different. Because for 3 days I was dying and didn't even know. For 3 days, my hours, my minutes, my seconds were limited. And I just thank God for having a care team and an OBGYN who looks at me as family and not just a number or as a patient, because she didn't have to call back. Well, she was going to call back. She loved me like that. But but I say that to say, if I can leave you all with anything today, is to, one, educate yourself as much as possible on just the smallest symptoms and signs. Like, treat your body like your car. Check engine light on, just see what's wrong. Shortness of breath can be a sign of a heart attack. I thought it was just me pulling a muscle. Vomiting, nausea. So anything, if I can leave you with anything, education, education, education. And thank you. It's so much that I just want to say, but I just want to leave you all with that and just say, I am so blessed. My purpose now is to go around and to tell my story and to educate people to please listen to your bodies. Please tell somebody when something is wrong. Please call your healthcare providers. Please look out for resources. Please use the resources that he's probably going to introduce today. But I just want to say thank you all for allowing me to share my story. And I don't want to take up too much more of your time and keep crying and being a baby. But thank you, God. Thank you all for allowing me to share my testimony with you. I do want to go into introducing the next speaker, which is Senator Emily Jordan. I just want to give you a little bit of background about her because I think it's so amazing and everyone should know. She grew up in Western Tidewater region of Virginia and now runs her small business and raises her family there. As a child of adoption, which I absolutely love because my best friend is too, she has always made a commitment to adoption and foster care reform as part of her legislative passion. She loves serving the constituents of the 17th Senate District, but her most important role is as a wife and as a mom of three. We're twins. With two of her children are under the age of 3. I love you for that. She is a mother of 3, just like me. She just recently had a beautiful baby daughter on September 20th. Isn't that wonderful? I'm not sure if you've seen her, but she is so amazing. She's over there. Look, you guys, look. She is so amazing, and she is such a happy little baby. Okay, I'm sorry. Now it's my honor to introduce our next speaker, Senator Emily Jordan.
Wow, how do I follow that? Well, first of all, thank you so much for sharing your story. It's absolutely incredible. Thank you. Stories like that truly matter because it helps us be better at what we do here. So, what a great day to be in the Commonwealth, and I'm sure all of you will find out here shortly why. But today is particularly going to be a great day for women. I cannot wait to hear about all of the things that we're going to talk about later about maternal health. But first, as a mom, and trust me, Mackenzie, she already got her shot in the back. Just think about what women process when they're going through pregnancy and childbirth. Navigating the uncertainty. Doctors, hospitals, visits, maybe not going to doctors, hospitals, or visits. All the things that you're collaborating with, the things that you read online, you're not sure of what to do or where to go. Everyone has a different idea of how you should handle it. I'm sure you probably have 5 or 10 friends that will tell you what you should be doing or shouldn't be doing. But with all of that, sometimes women forget to be empowered in that process. Women sometimes second guess themselves, just like Jasmine did. And the birthing process isn't easy. From my personal experience, I just had Mackenzie 3 months ago, but about 2 months and 3 weeks ago, I almost wasn't here. I didn't listen to myself once I got home. I got home and I was tight in my chest. Couldn't breathe. I hadn't slept in 5 days. All of a sudden, I had a horrible headache and I didn't know why. And I kept on writing it off in my own mind. I kept on chalking it up to, this is just what it feels like after having a baby. I should really toughen up. I have a husband and 3 kids now to take care of and 2 dogs. I don't have time to go see a doctor. And I kept on going through it. And I said, no, it got to a point where on day 5 where I didn't sleep and I was trying to breastfeed my baby, that I kept on just falling over tired and I couldn't keep my head up. And then I knew that if I accidentally dropped her, oh my goodness, I'd be a horrible mom, right? That's when I knew I had to do something for myself so I could help my family, but it took me that long. I went to the hospital and I was showing signs of eclampsia, and I spent 3 days in the ER and then ICU. And fortunately, I listened finally to my friends because I wasn't going to do it myself. In fact, I was so stubborn I had to have a friend send an ambulance to my home because I wasn't going to go anywhere and leave my family because I was that stubborn and I didn't listen to my body. And I think a lot of women feel guilty when they're going through either the birthing process or the pregnancy process because they have other responsibilities. And that's where we have to stop ourselves. We have to really think about those signs and our symptoms. We need to educate other women. We need to continually talk with each other about maternal health. And we need to be empowered to ask the right questions at the right time and stand up for ourselves and others. That's why today I'm so very excited about what Governor Youngkin is going to be introducing in regards to maternal health. I'm lucky that I'm even here now. I was literally drowning in fluid in my lungs. I was this close to not being in the Virginia Senate and certainly not being a mom at home of 3. And my husband would be without me, which is much worse. But today is going to be a joyous day, and I will tell you why. The most important thing that we can do in this Commonwealth is support moms, because everybody has one. And I want to make sure that in this Commonwealth, whether you live in Fairfax or Franklin, whether you are white, black, Hispanic, whatever your income level is, I want to know and have this sense of peace, regardless of your zip code, that every woman has a resource in a community and knows who they can reach out to when they have questions or they need help. And so with that, today, don't let it be just a moment where we talk about maternal health. Let this be a commitment to what we can do going forward, how we can help other women, how we can help our sisters, how can we help our mothers, how we can help our daughters, and making sure they take care of themselves so they can continue to take care of us. So with that, I get the honor of introducing our esteemed Lieutenant Governor, Winsome Earl-Sears. She is a mom, a wife, a Marine, and that's why I know that when we are charged with talking about maternal health this session, she will have orders and she stands ready to assist in all of these things. But most importantly, she has so many unique life experiences that have brought her to this moment, especially as a mom, not despite of it, and that I think empowers her to be one of the strongest lieutenant governors Virginia could ever have. With that, I introduce Governor Winsome Earl-Sears.
Hello, everyone. I come to you as not the Lieutenant Governor, if I can find my speech here. It's a conspiracy. But I come to you as a mother, and we've heard all of the stories. We've heard, thank you so very much for that story. It's the stories that stay with us after all, even after we hear the data that prompts us to do what we know that we need to do, because remember what she said. And so it is about education, and that it happened to you 2 weeks after birth. No, we wouldn't have put 2 and 2 together, and that it happened to you, the eclampsia, 5 days after birth, we wouldn't have done that either. And first of all, to hear all the cooing of the babies in this room that is such a political room where so many decisions are made, reminds us that maternal health and babies' health is not a political issue. No, it's a human issue. And so we all want to reduce maternal incidents, maternal deaths. And for my own story, it is also not a Virginia issue, because when I had my first child, I was still in the Marines and I was at Camp Pendleton in California at the Naval Hospital, and I almost lost her because she couldn't keep her temperature, and they had not known that. And then when we moved here, and it was now she was the mother. She almost died. She almost bled to death if I hadn't done a lot of screaming to get some attention for her. So it tells you that it's not also an income level issue. It's just a human issue, and we've got to recognize the signs and let everyone know what needs to be done, when it needs to be done, and education is key after all. The governor, of course, knows about that. He knows about it from being a father and watching his babies being born and watching his wife go through the maternal process. And so as mothers and fathers, as we hold our children for the first time, we instinctively know that our greatest responsibility is to nurture and protect these babies. And that's why we're doing this. That's why we're in this room of politicians and all. We're trying to preserve America, preserve Virginia, give hope, after all, to our children. We need our generations to continue. And so the loss of even one mother is unacceptable, and of course it has to be so. Behind every statistic is a family that will be forever changed, a child who would never know their mother, and you are not one of them, thankfully. So we are not accepting the status quo, and that's why we also need our doulas, our midwives, very important part of the process, your most trusted sometimes even, and so we need everyone to be involved. This administration has taken decisive steps from even day one to make maternal health not just a priority, but a cause for action. And so that is why it is my distinct honor to introduce our governor. For him, again, it is personal, and this time not just from a fatherhood perspective, but his mother was a nurse, as some of you may know. And she was a quiet but powerful advocate, as you can imagine. She was writing books about it, and she was serving Petersburg, especially, partnering with the communities and just uplifting maternal health throughout the Commonwealth. And so her legacy as a mom, a writer, a tireless advocate lives on in her son. So today, Governor Youngkin carries that forward, and we are reminded once again that we should care for others. That is why we are here. And so please stand and join with me in welcoming our 74th governor of our great Commonwealth, Governor Glenn Youngkin.
Thank you. Thank you all. Good morning. Please sit down. Thank you. I do feel a bit out of place to stand here as a dad and a husband and a son is very different than standing here as a mother. And I understand that. And so what I want to share with you today reflects an extraordinary amount of work from so many people. And I want to thank all of you, because the work that has gone on in the Maternal Health Task Force, the work that has gone on in collaboration with the General Assembly, and so many experienced advocates, professionals, nonprofit leaders, healthcare organizations, in order to drive forward on this most important topic, keeping moms and babies healthy, represents your work. and I have the tremendous privilege today to talk about it. I have to say that it is a topic that was discussed around our kitchen tables virtually every night. And Winsome, thank you for mentioning my mom. For those of you that have heard me talk about her before, she was my hero. And I remember her coming home at night. She was an OBGYN nurse and then an OBGYN nurse practitioner. And one of her greatest passions was prenatal care. One of her greatest passions was to make sure that women who might not have access to prenatal care had it. One of her greatest passions was to go into communities where maybe there was a mistrust of the medical community and rebuild that trust. And so I guess today I have the privilege of speaking for her a bit. So thank you. So Lieutenant Governor, thanks for starting this. Jasmine, what do we say? What we say is, first of all, amen is what we say. Yes. Second of all, we say thank you for your courage to stand here and share your story so that everyone can understand that your experience wasn't unique. Your experience wasn't a moment where it will just be fine. Your experience was real. And I will talk about lots of statistics today, statistics that almost feel clinical, when in fact it's moms we're talking about. And so thank you for grounding us in the reality of what we're speaking about. Senator Jordan, thank you. Thank you for your strength. Boy, that was a tough number of months. And we're so glad that you're here now. It was a time I know that it was so hard on your family and you, but I have to say all of us that were with you prayerfully, it meant a lot to us too, to have a chance to walk with you and support you during what was, again, not a unique circumstance. I want to thank Janet Kelly for your leadership. There are many people in this administration who bring passion. But I say when it comes to children and families, you stand above them all. And so thank you. To our partners in the General Assembly, this is not a partisan issue. This is an issue that we have locked arms and worked on, and we have made incredible progress. And so thank you. I also want to thank all the members of the reestablished Maternal Health Data Task Force. The work that you are doing is so critically important so that we can understand what is going on and how can we address it. And that we can, in fact, make sure that there is not a single statistic, not a single tragedy, not a single child who will grow up without their mother. And so that's the mission that we all share. Across all regions of the Commonwealth, across government, local, state, and federal, across party lines, across organizations, and across families. And the clear issue at hand is that there should not be a single mother who is lost because of health conditions while she is either pregnant or in postpartum. And we know that there's a disparate outcome between black women and white women, between Hispanic women and white women, between Native American women and white women. And we know there's a disparate outcome between mothers in rural communities where there's a maternal health desert. And so given the reality of that, we need to continue the work that has been undertaken from the day we all came in together. And I have to say that we have made substantial progress, but there's much more to do. In 2021, and you may ask yourself, Governor, why are you talking about 2021 when it is 2024, soon to be 2025? At the heart of that challenge is the fact that the data that we have is outdated, it is incomplete, and as a result, the picture that we are trying to paint together of a healthier Virginia is often hard to paint. But in 2021, there were 64 pregnancy-associated deaths in the Commonwealth of Virginia. That was a decrease from 82 in 2020. And again, I will repeat, every single tragic death is just that, an incredible tragedy. We know that maternal health experts estimate that of that total, 80% of pregnancy-related deaths are medically preventable. One of our core examples sits here, and yet another one sits here. They're medically preventable. 23% of those deaths are related to cardiovascular issues. 20% of them to mental health and substance use disorder issues. 14% cancer. My friends, these are topics that we must talk about before we have a 3-day heart attack, before we have an emergency that almost took the life of a great mother and a great wife. These leading causes now are better understood because of the work that has been going on in the Commonwealth. To get at the issues with maternal mortality, I'm going to break my comments into 3 key issues: coverage, access, and these underlying conditions, and what we are doing in order to address them so that there will not be a single tragic statistic. Of the 64 pregnancy-associated deaths recorded in 2021, over 80% of these mothers had health insurance coverage. And yet, we are concerned that many of them may not avail themselves of that coverage. I learned this at the kitchen table. Moms need care. Moms need repeated care. Moms need trusted care. Moms need that OBGYN that will call and wake them up and get them to go to the hospital. Access to that care is critical. As a result, maternal health deserts exist. We spent the last 3 years working tirelessly in one of them, the city of Petersburg. I'll share some of our observations. The workforce is way too thin, and it's been stratified in a way that so many of those that can provide care were previously prevented from doing that. We've made incredible strides. We now have 191 doulas that are certified in the Commonwealth of Virginia. It's happened over the last few years. More community health workers, more midwives. OBGYN pediatric residency slots have been increased and funded. We have had a massive effort to increase the number of nurses in Virginia. Mobile maternity services have been deployed in healthcare deserts. And I have to say that they are working. There are substantial resources being devoted. Nearly $500 million a year is invested by the Commonwealth in maternal health care each year, mostly through Medicaid, but also through the Virginia Department of Health and the Department of Behavioral Health and Developmental Services. One of the biggest developments in the last year has been the fulfillment of legislation that was passed on a bipartisan basis to add a year to postpartum care. To add a year so that, in fact, behavioral health challenges and physical challenges, health-related challenges, cardiovascular-related challenges can be addressed. I do believe that this work, which does fall in these three big buckets, have been supported by a number of key initiatives. The first has been to develop actionable data that understands from every tragic statistic that we must better inform the medical care that we provide. Second, that we have to partner with our hospitals, our managed care organizations, and our tremendous nonprofit network to create targeted initiatives that ensure services are accessible to mothers-to-be, and that those mothers get the help and support they need to navigate this system to get the care. And third, to raise awareness. To raise awareness among high-risk women and the medical community that there are very real dangers that women can face while pregnant and postpartum, and to make sure that those women and the medical community fully understand the resources that are available to them via hospitals, insurance plans, and even over the counter. Now, we've made the development of actionable maternal health data a top priority. For too long, we were operating in the dark. As I commented earlier, the statistics that I shared with you were from 2021. Now, we have preliminary data from 2023. It needs to be confirmed. But what I can tell you from the preliminary data is we have made substantial progress in reducing the number of women who have died either before or after childbirth. That whole data set will become fully available this spring. With that said, it is this lack of data that we can thank former Senator Siobhan Donovan, who, those of you who don't know her, is one of the leading OBGYN physicians in the area, an expert in maternal health, a fabulous mom, a wonderful woman, and she championed legislation for annual data. And that's what we are about to have access to. Furthermore, the data collected and publicly reported has been too high level without enough details to help health officials at all levels of government to take actions to support the health of mothers and babies. As part of our partnership for Petersburg, we built a maternal health dashboard in 2022. Talked about Petersburg a lot over the course of the last 3 years. It has been just a massive, massive learning environment for us across the entire Commonwealth. But this effort for the maternal health dashboard has informed so much of what we are talking about today. This dashboard tracked maternal and postpartum data. We used that data to inform our actions with local partners to improve the health of mothers and babies. And what we learned in Petersburg, we then started to do across the Commonwealth. And yes, the executive order that I issued, Executive Order 32, to reestablish the Task Force on Maternal Health Data and Quality Measures, came out of this work. It formalized our efforts to make sure that this process of understanding and seeing root causes was so important and it would last beyond our administration. This executive order reestablished this task force, and it is part of that data set that we are using to inform the decisions that we're making today. Expanding access to care has been critical. Again, early work in the city of Petersburg, specifically working with providers ranging from Medicaid managed care organizations to nonprofits such as Urban Baby Beginnings. And I have to tell you what an organization it is. We have been able to make sure that women and their families are connected to care. We worked with our partners in expanded clinic hours, like Saturday OBGYN hours at Bon Secure Southside Medical Center. We recruited our managed care organizations to create mobile units and proactively schedule prenatal and postpartum appointments. And statewide, we worked with Inova Health Centers to create extended hours to access the health system to increase availability for expecting mothers. The results are incredibly encouraging. We increased by 20% in postpartum OBGYN visits for Medicaid members in Petersburg. OBGYN visits rates have increased by 30%. And statewide, OBGYN visit rates have increased by 11%. We've also expanded access to doula services, and I mentioned this earlier. What an incredible statement that, in fact, we need a network of support of healthcare providers around our mothers, and doulas and midwives are so important. 191 doulas have received state certification, achieving 259 doula-supported births for Medicaid members, and supporting 349 families that receive doula services covered by Virginia Medicaid. We partnered with Germanna Community College, Mary Washington Hospital, Rappahannock Health District, and the VDH to create a doula training program. And the first group reached full capacity, and future semesters are already fully subscribed. This is about developing the workforce of the future to take care of moms. And it's so important. Finally, awareness and an understanding of these health-related issues that we, in fact, need to start addressing. Just recently, as an example, we launched our Ask About Aspirin campaign, which encourages providers and patients to discuss low-dose aspirin as a preventative measure for preeclampsia, a leading cause of maternal mortality. Now, it's hard to believe that a solution that is so simple and inexpensive is also highly effective in combating one of the leading drivers of maternal mortality, cardiovascular health. It's a good reminder that sometimes the best solutions are simple and certainly don't come from government. Now, today, we are taking executive actions, announcing legislative proposals, and introducing some budget proposals that I will release tomorrow as I communicate with our money committees our full budget package. Today, I will sign proudly Executive Directive 11, supporting healthier pregnant women, mothers, and infants by reporting actionable data on maternal mortality. This is a key recommendation of the task force work. Accelerating and strengthening the collection and publication of data is vital to continuing our work to produce results for Virginia's mothers and babies. This directive instructs the Virginia Department of Health to enhance the maternal and child health data dashboard. Please hear, it worked in Petersburg, we're taking it statewide, to include actionable data on pregnancy-associated and pregnancy-related mortality and causes, and to establish a centralized maternal health website to provide families with essential resources in one accessible location. Where do I get help? Where can I find information? And how can I get it all in one place? In order to sharpen the data we've collected and to learn more from it, I am also directing the Office of Transformation in the governor's office to use $1 million of already appropriated funds to support the implementation of this executive directive and to support the maternal health data and quality measurement task force going forward. We are learning so much, but we can do so much more. Finally, I am directing DMAS to form a work group of all of our Medicaid managed care organizations, directing them to ensure that all Medicaid patients are actually receiving the prenatal and postpartum care that we are already funding. We must work to make sure that moms who have health insurance coverage are actually receiving the care that that coverage provides. And our managed care organizations must be at the front of making that happen. We'll also work with the General Assembly to support legislative proposals that will protect and support mothers. We'll work with the General Assembly to require all hospitals to implement safety bundles designed by the Virginia Neonatal and Perinatal Collaborative at VCU. If you have not spent time understanding the great work that is being done at VNPC, I'd ask you to do so. This means that hospitals will adopt standardized management protocols to implement communication among providers and lead to improved clinical outcomes. Hear me, bundles mean protocols that incorporate the fact that there may be complicating health circumstances that need to be taken into consideration all at one time. The fact that 23% of maternal mortality is caused by cardiovascular care, and the two stories that you have heard today reinforce that. We must do more to inform and integrate care. I will work with the General Assembly to pass legislation that will allow out-of-state midwives to practice in Virginia through licensure by endorsement. Folks, this is a time for us to not worry about a specific need for another license. We have had universal licensing in Virginia. It works in so many different areas. It should work with our midwives. And in support of the VNPC, they recently were awarded $7.5 million from the federal government to fund this collective work. I'm incredibly proud of the work going on at VCU. And tomorrow, my budget release, I will include 4 additional initiatives. First, my budget will propose funding for perinatal health hub pilots of $2.5 million. These hubs will target coordinated care and community engagement with outcomes evaluated through comprehensive reporting. What we're seeing, having worked in Petersburg, what we know works through the VNPC, we are now piloting in other places in Virginia. And if you want to see how this works, please go visit Stephanie Spence at Urban Baby Beginnings, and you can understand the tremendous success that they have seen with these hubs in helping moms. My budget will include $500,000 of educational campaign to provide moms with life-saving information about maternal health warning signs, behavioral health screenings, and preeclampsia prevention. As part of this awareness campaign, we hope that moms and members of the support communities, including fathers, are better informed about the risks, signs, and steps to take regarding these serious pregnancy-related health challenges. I want every single husband to respond just like your husband did. Call your doctor. Third, the budget proposal strengthens Virginia's maternal health workforce by allocating an incremental $1 million to expand doula and community health worker programs, prioritizing localities with the highest maternal mortality rates. This works. We need to do more of it. And I'm so excited about the learnings that we have had. And finally, we'll include increased payments for psychiatric and OBGYN graduate medical residency. We need more doctors. And that's what we're supporting. The net of this is that we have made huge progress, but until we have zero tragic statistics, our work is nowhere near done. And therefore, making sure that there is insurance coverage, that coverage translates into access, addressing the maternal health care deserts and the workforce shortages, to make sure that we are understanding the interaction between other health issues, and that these are healthcare circumstances that are preventable. We have to go to work. I want to finish where I started. Virginia, I have to say, my friends, is the best place in America to live and work and raise a family. I want to make sure that the raise a family part of it is beyond good. It must be great. And what that means is that we are supporting moms, we are supporting babies, we are supporting this amazing, life-giving journey of a woman bringing a life into this world and making sure that she is healthy and her baby is as well. I look forward to continuing this journey together as we, in fact, make sure that every mother gets the support, the care, and, of course, that her baby enters this world ready to take advantage of an enormously empathetic, caring, and loving Virginian. And with that, I wish everybody a blessed holiday, a Merry Christmas. Thank you very much.